name is Jason Ballou. I practice in Rancho Santa Margarita, and I have been in practice 15 years. I was considering another system. Well, actually, the twisted was working great for me, so I wasn't sure if I was going to make that change. I know about that same time Wave 1 was coming out, so there was a lot of push for that too. But I ended up with the TFA Adaptive just because in my hands it felt better to me. It's opened up my practice to more difficult cases. When I started way back when, I was doing anterior teeth only, really easy, younger patients, that kind of thing. And at this point, as I've gone through the files to get to this point, I'm doing molars. There's really not a whole lot I can't do. I have a lot of confidence at this point. Even to the point where my partner is referring endo to me now, and I'm doing his because I can do it. You know, it's giving me confidence. Since switching to the TFA, I have learned a few things. One, not to be so nervous about when I get into a canal that's calcified, because I can trust my file to do what it's supposed to do and not break on me. I think that has a lot to do with just the reciprocal motion on it. It doesn't bind. So I have this confidence because of the added safety. So it's let me do more and more root canals and not be so scared of ones that look hard on the x-ray. How many root canals do I treat a month? You know, it varies. I do it for 2 different practices, actually 3 practices now, and I want to say, I'd have to look at my books, but it's definitely double digits, probably close to 20, I would say.
And has that number gone up since you started?
Oh yes, oh yeah. We were talking 1 or 2 a month, really easy ones. Once I got a little more confidence and started trusting my materials and my files, the number went way up. When I'm booking a root canal, I'm not booking 2 hours for it. You know, most of my molar root canals are getting within an hour or so at this point, so I can do more per day. I don't refer a lot of my calcified canals anymore because I know I can get through that. A lot more molar than I used to do, and it's really opened up the practice for me and been a great thing for my practice actually. The initial investment, it is money, and as we run a practice, we all know as dentists that we have to keep our overhead really low, so it doesn't do us a lot of good to make a lot of changes, you know, when the new thing comes out. This was an easier decision because I knew from what I was hearing that I could go much quicker. There's fewer files, and I could probably get more cases per day using this new technology, and not referring as much. Endodontists are going to hate that, but not referring as much, keeping some of the harder cases in office, which I think the patients really appreciate. They don't usually like to go across town.